Hello, and welcome to the ISTH World Thrombosis Day Ask the Expert series. Today, we'll be addressing your questions on evolving treatment paradigms for venous thromboembolism, commonly referred to as VTE. I am your host, Dr. Thomas Tu. I'm an interventional cardiologist and the Chief Medical Officer at Inari Medical, based in Irvine, California. I'm pleased to be joined by Dr. Rachel Rosovsky, a board-certified hematologist and assistant professor at Harvard Medical School. She's the director of thrombosis research at the Division of Hematology at Massachusetts General Hospital, and she's also the vice president of the National Pulmonary Embolism Response Team, or PERT, consortium. Dr. Rosovsky, it's great to have you here today.
I am honored to be here. Thank you for having me.
It's a really interesting time in venous thromboembolism. You know, from medical school, this was historically a fairly simple thing to think about. It was just anticoagulation, maybe systemic thrombolysis for those who are critically ill. And I would dare say maybe even a sleepy area of investigation up until the past few years. And now there's been an explosion of investigation and options for treatment, medical and interventional therapies. Can you talk to us about why this is happening now?
Well, I think in part it's due to what you just said. There's actually so many different options available now. I mean, if you think back to how PE was treated in the 1960s, patients were admitted to the hospital and treated with unfractionated heparin and bridged decubitin for 3 weeks. And it wasn't until the 1990s that we started using low molecular weight heparins. And really only in the last decades do we have the direct oral anticoagulants. But Dr. Tu, you know that anticoagulation alone is not enough for some patients. And if you look at the advanced therapies, for a long time, we only had surgery and systemic thrombolysis. But as you know, there's been an explosion of advanced therapies. And I think that has led to a lot of interest. And in particular, thinking about what patients should we use for these advanced therapies. And there's so many options now. How does a clinician decide whether to use an advanced therapy? And if so, which one? And can you use the direct oral anticoagulants with advanced therapies? I think there are so many questions that we need to explore, and we really need experts and trials to help answer these questions.